Alcohol is a toxic and psychoactive substance with dependence-producing properties. In many of today's societies, alcoholic beverages are a routine part of the social landscape for many in the population. This is particularly true for those in social environments with high visibility and societal influence, nationally and internationally, where alcohol frequently accompanies socializing. In this context, it is easy to overlook or discount the health and social damage caused or contributed to by drinking. Alcohol consumption contributes to 3 million deaths each year globally, as well as to the disabilities and poor health of millions of people. Overall, harmful use of alcohol is responsible for 5.1% of the global burden of disease. Harmful use of alcohol is accountable for 7.1% and 2.2% of the global burden of disease for males and females respectively. Alcohol is the leading risk factor for premature mortality and disability among those aged 15 to 49 years, accounting for 10% of all deaths in this age group. Disadvantaged and especially vulnerable populations have higher rates of alcohol-related death and hospitalization. Alcohol is a drug that affects the central nervous system. It belongs in the class with the barbiturates, minor tranquilizers, and general anesthetics, and it is commonly classified as a depressant. The effect of alcohol on the brain is rather paradoxical. Under some behavioral conditions, alcohol can serve as an excitant. Under other conditions, as a sedative. At very high concentrations, it acts increasingly as a depressant, leading to sedation, stupor, and coma. The excitement phase exhibits the well-known signs of exhilaration, loss of socially expected restraints, loquaciousness, unexpected changes of mood, and unmodulated anger. Excitement may be caused indirectly, more by the effect of alcohol in suppressing inhibitory centers of the brain than by a direct stimulation of the manifested behavior. The physical signs of excited intoxication are slurred speech, unsteady gait, disturbed sensory perceptions, and inability to make fine motor movements. Again, these effects are produced not by the direct action of alcohol on the misbehaving muscles and senses, but by its effects on the brain centers that control the muscle activity. The most important immediate action of alcohol is on the higher functions of the brain, those of thinking, learning, remembering, and making judgments. Many of the alleged salutary effects of alcohol on performance, such as better dancing, happier moods, sounder sleeping, less sexual inhibition, and greater creativity, have been shown in controlled experiments to be a function of suggestion and subjective assessment. In reality, alcohol improves performance only through muscle relaxation and guilt reduction or loss of social inhibition. Thus, mild intoxication actually makes objectively observed depression, and dancing for that matter, worse. Experiments also indicate a dependence of learning on the mental state in which it occurs. For example, what is learned under the influence of alcohol is better recalled under the influence of alcohol. But what is learned in the sober state is better recalled when sober. Effects on behavior. People ordinarily drink alcohol to obtain effects that they have been taught to expect. The state of expectation combines with the pharmacological action of the drug to produce the desired effect. Small amounts of alcohol are drunk in the expectation of reducing feelings of tension, relieving feelings of anxiety, and conversely, experiencing exhilaration and a loss of inhibition. The anxiety-suppressing action of alcohol is largely a function of muscle relaxation and the removal of social inhibitions. But anxiety reduction is also a function of suggestibility and of the cultural permissiveness present in drinking settings. Shy people become outgoing or bold. Well-behaved people become disorderly. The sexually repressed become amorous. The fearful become brave. The quiescent or peaceful become verbally and physically aggressive. In people with clinically diagnosed anxieties and phobias, however, alcohol is little better than a placebo. And alcohol consumption actually worsens sleep patterns, depression, and the risk of suicide. In folklore, brandy for treating faintness, spirits as a spring tonic, beer for lactation, and any alcoholic beverage for treating sleeplessness and overexcitement. Such uses depend on popular belief, not medical fact. Physicians often prescribe a drink for a variety of purposes: to stimulate a sluggish appetite, to help relieve premenstrual tension in women, to act as a vasodilator, an agent used to widen the lumen of blood vessels in arteriosclerosis and to relieve the vague aches and pains that beset the elderly. These salutary effects, however, are psychological more than they are pharmacological. Alcohol is important pharmacologically for use with some active medicines that are poorly soluble in water but readily dissolve in alcohol, and for preventing delirium tremens during alcohol withdrawal in alcoholics. There is evidence that the occasional drinking by an expectant mother can endanger the development of the fetus and result in a variety of birth defects. These are referred to together as fetal alcohol syndrome. The defects include abnormal physical features, disorders of the central nervous system, and slow development. Some specific signs of fetal alcohol syndrome are a small head, small eyelid openings, a sunken nasal bridge, a cleft palate, defective joints in the hands and feet, heart abnormalities, and mental impairment. Some babies may be so severely affected that they die soon after birth. When their brains are studied, they are found to be poorly developed with portions sometimes entirely missing. Much current medical opinion supports the view that alcohol should be totally avoided during pregnancy because of the possibility that the fetus may be harmed by even very low or infrequent doses. In 2005, the United States Surgeon General issued an advisory that no amount of alcohol consumption can be considered safe during pregnancy.